Hello, I'm Dr. Regina Smolyak. I'm a glaucoma specialist at Flaum Eye Institute. Glaucoma is a disease of the optic nerve that damages optic nerve in a silent manner. The biggest risk factor for glaucoma is increase in intraocular pressure, but it's only a risk factor. People without increase in intraocular pressure still can have glaucoma and have damage of the optic nerve that will lead to visual field defect and rarely but potentially to blindness. Glaucoma visual loss occurs from outside to inside. The only way to know if you have glaucoma is to have a regular visit with your ophthalmologist or optometrist. There's no cure for glaucoma. The glaucoma can only be maintained, and when people come with glaucoma, if they come with damage, the goal of the treatment is for the damage not to progress. And if there is no damage, then the goal of the treatment is to keep the eye as healthy as it is in the current presentation. The standard at the beginning is intraocular drops and lasers. There are different kind of lasers and different kind of drops that are available to control intraocular pressure. And when drops or lasers are not working or are not possible to use, then we go to surgical treatment. The life for a patient for glaucoma can be as easy as it gets with chronic disease, because fortunately it's very rare when glaucoma take people's vision away, especially if they've been diagnosed on time and adhere to the treatment and regular follow-ups. It is important to take your drops and to follow up closely. The only difference between the patients with, I would say there is actually no difference between the patient with any chronic disease and glaucoma. So I would think about glaucoma as the chronic disease that requires chronic consistent treatment and chronic consistent follow-up with your medical provider.